Health is influenced by many different factors, such as genetics, behavior, environmental, and social issues. The social determinants of health are the conditions in which we are born, grow, work, live, and age, and the systems that shape these conditions. In November 2019, the first ever Commission on Social Determinants of Health for the WHO's Eastern Mediterranean region was established to examine health inequities and recommend ways to tackle them. The Commission's report offers a path-breaking picture of health inequity in the region. Life expectancy in this region is below the global average of 72 years and varies widely between countries. Much of the difference between countries is due to different levels of development and the effects of conflict. Conflict affects nearly half of the countries in the region, impacting health and healthcare, employment, income, education, and shelter. Income growth has fallen far behind population growth in recent decades. COVID-19 lockdowns and restrictions have hit economies and jobs in the region, particularly among women, migrants, refugees, and people in rural areas. The gross domestic product, GDP, in countries is set to shrink by more than 4%, and by 13% in conflict-affected countries. Climate change, such as extremely hot temperatures, decreasing precipitation, and desertification is a threat to agriculture and biodiversity, meaning more poverty and migration, and worse human health and well-being. Gender inequality is higher in the Eastern Mediterranean than in most other WHO regions, reinforcing inequities in employment, income and education, and reducing opportunities for a healthy life. Major investment in child health has cut under-5 mortality dramatically in recent years. However, 70% of maternal deaths in the region could and should still have been prevented. To reduce health inequities, policymakers, communities, and individuals need to understand how these underlying social determinants shape health and well-being. Evidence shows that health inequities can be reduced. To start with, we need to make health equity a key concern in all government policies. Social justice should be at the heart of decision-making. The whole of society and all government departments should be involved in reducing inequities and improving health. The COVID-19 pandemic has shown that working together to improve health can help promote peace in conflict situations. Emergency relief, reconstruction, and peace-building initiatives in the region should always include a commitment to equity in health and the determinants of health. We should build back fairer in the Eastern Mediterranean. Let us start with health equity. Each one of us has a role to play. Let's do it together.